Thanks for staying with us. Encouraging vaccine take-up is likely to be more challenging amongst the youth because they perceive themselves to be at lower risk of contracting COVID-19. A new UNICEF South Africa poll shows that only 55% of young people would get vaccinated against COVID-19 if it's recommended to them. 22% of them say they will not get the vaccine and 23% are still unsure. Now, UNICEF is working with the health department to get the youth to take the jab. For more on this, we're joined by UNICEF's South Africa representative, Christine Muhigana. Christine, thank you so much for your time this evening. Now, give us an idea of just how you went about compiling this survey or this report in the first place.
So this is a poll, and what we did is ask young people through a free U-Report tool. This works through, smartphone phone devices, whereby we ask questions to what we call U-Reporters, so young people who are affiliated, who are members of this tool, and we got actually more than 5,000 young people to respond, and the results are exactly what you just presented, and the objectives with this poll is for us to have a better or further insights into how young people perceive the COVID-19 vaccine in South Africa.
Do we have an idea in terms of the responses that you got where these respondents were based? Are they rural? Are they urban? Was there any of that that could be mitigating factors in terms of how they answered some of these questions?
So this is nationwide. 75% of those who responded were young people up to 24 years. The poll was nationwide. We ran it for 3 weeks in each of the provinces of the country. So we feel that it's really representative of the opinions of young people in the country.
Now, according to the survey, it found that 86% of the respondents think that the COVID-19 vaccine is important. Now, 86% is very high in terms of response to a poll like this. But then you've got 22% saying that they won't get the vaccine and 23% saying they're still unsure. Why do you think there's that reticence? 86% say they know it's important, but quite a high number saying they still don't think that they'll get it.
Right, it's a relatively high number. Yes, 22% is not small. And what they're saying to us is that, or what they're saying through this poll, is that they are concerned about side effects. This is 60% of those who were polled was, saying that they were worried about that. And also from the knowledge that they have of perception around them, that 44%, so 44% of those polled would say that their friends, only 44% of their friends would get vaccinated. So there is the fear or concern over side effects, rumors and myth, for example, the fact that the vaccine may affect fertility is also something that's circulating. So really, what we need to do is get right, factual, correct information to young people so as to dissipate these concerns that they have or this misinformation that's circulating. We need to make sure that those 86% young people who feel that it would be important for their health, to get the vaccine, to get over the hesitancy that they're getting by giving them information that address these concerns, these worries that they have.
44% you mentioned there believe that their friends will get vaccinated. How important is positive peer pressure in the situation that we find ourselves in?
It's very important, and that's why we want to work with young people. We already work with them, actually. We will make sure that, in the communication that we build targeting young people, we use other young people. We want to empower them with the information that allows them to convince those who are still hesitant, particularly those who would have gotten the vaccine. So we're using a number of platforms whereby we use young people, or we empower young people to be the messengers of, you know, the factual, the credible, the correct information about the vaccine. But what the poll also is telling us is that they believe that traditional TV, radio are actually trustworthy messengers, you know, that they carry, that you know, they're trusted by young people. So it's important also then that in the way that we approach this hesitancy of young people, we do that in partnership with media, and we're very happy that you have us tonight to carry this message as well. The second, you know, highest trusted source of information for young people is health workers. So we want to also partner more with people in the health sector to make sure that, you know, when they're in contact with young people, they make sure that they give them the information that they need to overcome their worries and concerns.
Now, misinformation and fake news has been a massive issue. Some might say even the biggest issue standing in the way of more and more people getting the vaccine, not just amongst young people. I was surprised to read the poll results on young people believing that television and radio platforms are more trusted, because if you look at surveys and reports on how young people are receiving the news and what media they do consume, you would think that the more traditional television and radio is quite low on the list. How difficult is it then to decide how to communicate with young people? Because they really are a generation that take their news and consume media on so many different kinds of platforms.
Absolutely. So that's why we want to make sure that we reach out to them through those various channels that we know will reach them. They're telling us that, you know, television and radio is trustworthy, so we will be out there communicating through those channels. I talked about, you know, making sure that health points, health workers, you know, are also in touch and attentive, you know, to the concerns and worries of young people. And then we using as UNICEF in our work, in the work we do with the national department and provincial departments of health, using a number of various platforms where we know we can reach young people in the communities. We launched with TikTok one campaign with African Union. This is an Africa-wide campaign called Myth or Vax, whereby we would include some, you know, quizzes for users to engage in, whereby we would, you know, have celebrities and young people interact, you know, advocates, people who can influence young people, again, other young people. We will, for example, for South Africa, have our UNICEF advocate, Maps Mabonyane, talk to Professor Abdul Salim Karim, so that, you know, there is this interaction with the health expert and a young person. We also engaging with communities through a truck, a multimedia truck that goes in the communities and carries the voices of people from the community, again, young people as well, to make sure that, you know, the correct, the right messages are given to the community. We also have a campaign called Zwakala, which features youth role models who are actively calling for COVID-19 prevention, but also vaccination. So, as you said, you know, we have to not only know what worries and concerns young people have, but also make sure that we are with the right information, with the right communication on the various platforms where we know we will we'll be able to reach out to the young people.
Before I let you go, Christine, I mean, we often talk about, the various media platforms, but a large part of South African society is not connected to social media. Data costs are very high in South Africa as well. How important is community level and grassroots level, street level conversations in trying to communicate with the youth, in your experience?
It is absolutely important, and that's why we have the campaign or the engagement with this multimedia truck that goes in the various communities. It goes in various provinces. It stops. It shows images of people talking to the community. These, in the absence of being able to be very close to people because of the nature of this pandemic, being able to move around in a way that is still safe in terms of protecting ourselves and the communities from the risk of infection by the pandemic. The fact that you move into the communities is very important, and it's actually proven to be a powerful tool for the work that we're doing, so much so that other sectors are actually asking us to see if they could use this approach, this intervention, for example, for messages around gender-based violence, child protection, from violence in schools, getting the messages out through this intervention that goes into the communities, gets people to talk, gets young people to see, to get information and, talk about it around them.
And having somebody that they can ask questions to in person and get the answers in a way that they can understand, I'm sure, is far more effective than just showing them videos and that kind of thing. Thank you so much for your time this evening, and we wish you everything of the best, the important work that you and your team are doing. That's UNICEF's Christine Muhigana. She's the South Africa representative.